It pressed into Klaus Hoffmann's face and filled his mouth when he tried to breathe. The air tasted of coal smoke, old sweat, and disinfectant that had already failed. He lay strapped to a stretcher lashed to the floor, and every vibration of the wheels translated into a tug along 9 stitched lines beneath his bandages. The stitches held, but the pressure reminded him what they were holding back, and the reminder cost him sleep. When the train lurched over a joint in the track, his abdomen tightened as if it were bracing for impact. He swallowed, felt a pull under his ribs, and realized his skin was too hot. He tried to keep still, to keep quiet, to be less visible to the world the way he had learned to be in the last weeks of the war. The attempt produced only a tighter chest and a faster pulse, and the faster pulse fed the fever he was trying to ignore. Private Cass appeared beside him with a small medical kit that looked like an apology. Cass's uniform was neat, his hands smelled of iodine and cigarette smoke, and his voice did not rise. He slid a thermometer under Klaus's tongue, waited, then looked at the number with a narrowing of posture Klaus recognized from surgeons, calculation replacing comfort. Cass wiped Klaus's forehead with a damp cloth, listened to his lungs and checked the bandage edge for dampness with fingers that pressed lightly but decisively. The immediate result was that Klaus felt seen and managed. The cost was clarity. The kit was small and the railcar was no place to correct big mistakes. "It's up," Cass said. He opened the kit so Klaus could see what up meant in practical terms. Gauze, iodine, a few vials, a canteen, and not much else. "If it climbs, I've got little." The gesture did not threaten Klaus. It educated him, and education made the danger precise. The cost was that precision gave fear a solid shape, and solid fear was harder to dismiss. Klaus met Cass's eyes, and with effort lifted 2 fingers, an awkward signal, but clear enough. He would not pretend. He would not hoard pride. If his body slipped toward failure, he would ask for help early, because early was the only advantage he still possessed. Cass nodded once, as if accepting the bargain. The train kept going, and the bargain did not make Klaus safe. It only made him accountable for the next decision. 2 weeks earlier, the world had been smaller and still. Camp McCain's hospital was not generous, but it was stable. The floor did not move, the light came through windows. When Klaus woke from surgery, he woke to a ceiling that stayed put and to bandages that smelled clean enough to believe in. He could touch the dressings with his fingertips and confirm he was alive without having to negotiate with motion. The result was a fragile sense of control. The cost was that control depended on routines repeating and on one doctor continuing to show up. Major Brennan became the routine. Brennan spoke German slowly, checked Klaus's pulse longer than necessary, and never promised comfort he could not deliver. He lifted bandage edges, watched for redness, smelled for infection, and asked about sleep without pretending sleep would come easily. Klaus learned Brennan's steps in the corridor and the sound of paper when Brennan reviewed the chart. Familiarity reduced panic by giving it edges. The cost was dependence. Klaus began to feel that if Brennan left, the floor would begin to move again. On the morning Brennan decided to push for transfer, he carried a folder so thick it looked like a second body. He set it on a desk, turned pages with deliberate weight, then came to Klaus's bed and checked vitals again. "Stable," Brennan said in German, shaping the word carefully, "but not safe." He pointed to the bandages, then to Klaus's trembling hands when a cart clattered in the hallway. The assessment produced a clear conclusion. The camp could keep Klaus alive in the short term, but it could not restore him to anything beyond survival. The cost was that survival was no longer enough. Brennan named Texas as if it were a tool rather than a place, a specialist hospital camp. More doctors, structured physical therapy, psychiatric oversight. Klaus heard the last item like a threat, because nightmares felt like private territory, and because psychiatric sounded like interrogation when spoken by an enemy. Brennan did not argue with Klaus's fear. He argued with his prognosis, 9 wounds meant 9 chances for infection. Weak lungs meant pneumonia. Panic meant exhaustion that would slow healing and increase risk. The result was a medical logic Klaus could not refute. The cost was that logic demanded travel, and travel was where weak men died. The days that followed turned into paperwork and waiting. Brennan wrote summaries that translated blood and fear into headings. Operation notes, medication list, wound care plan, mobility restrictions, risk factors. Clerks arrived for signatures. Nurses lowered their voices near Klaus's bed, as if volume itself could disturb a decision already moving forward. The result was that the transfer became a real object in the world. A file, a request, a chain of forms. The cost was that Klaus watched his future become something that happened above him rather than with him. Colonel Harrington did not visit the ward. His decision arrived through conditions. Brennan returned with a sheet marked "Approved" and pointed at the lines that mattered. Escort required, medical record complete, supply list verified, receiving camp notified. Approval solved the question of whether Klaus would go. The cost was new. The transfer was now judged by failure modes, and failure would have a chain of blame with names attached. To satisfy the conditions, Brennan had to make the record airtight. He called in Dr. Rubin, the psychiatrist assigned to the camp, because Rubin's report would justify the transfer as more than a surgical matter. Rubin's German was better than Brennan's, his eyes colder, and his questions landed like scalpels. Did Klaus dream? Did he wake afraid? Did he feel he was still there in the ditch where he had been hit? Klaus tried to deny it, to make the question stop. Rubin wrote anyway, watching the lie reveal itself in Klaus's clenched hands and shallow breathing. The result was that Klaus's fear became a documented risk. The cost was that the document would follow him and define him in rooms where no one knew his face. After Rubin left, Brennan sat at the desk and rewrote the summary again, slower this time. Klaus could hear the pen scratch through the ward's quiet. Brennan included small details Klaus wished were not relevant. That loud noises triggered tremors, that Klaus startled at footsteps, that he avoided sleep without realizing it. The notes produced precision that would protect Klaus in the system. The cost was that Klaus felt reduced to symptoms, as if his personality were irrelevant beside his risk profile. There was also the waiting for acceptance. Harrington's approval meant nothing if the receiving camp could not take him. An orderly brought a telephone cart into Brennan's office. Klaus heard the muffled cadence of an operator, the clipped repetition of numbers, the delay that made silence feel like a verdict. Later, a telegraph machine clicked in the corridor, and the nurse read a reply aloud to Brennan. Confirmation of bed availability, transfer date approved, receiving officer listed by name. The result was finality. A date replaced uncertainty. The cost was that the date arrived before Klaus felt ready to be moved. When Brennan showed Klaus the complete packet, Klaus recognized the structure even without reading the English. Dates, stamps, signatures, checkboxes. It looked like the German forms he had signed in training without thinking. Brennan tapped the top page and said, "This is how they keep you alive on the road." The sentence produced reassurance for a second. The cost was the second thought that arrived immediately after. The enemy now owned the description of his body and the story of his mind. Klaus tried to sit up to protest and failed. The motion sent a flare through his abdomen, and Brennan steadied him with a hand that did not ask permission. Brennan leaned close enough for Klaus to smell coffee on his breath. "Fear is not failure," he said, "but fighting the wrong thing is." The result was instruction that sounded like advice. The cost was that Klaus did not know what the right thing was until he had already paid for getting it wrong. Departure came without ceremony. Orderlies lifted Klaus onto a stretcher, and the change and pressure across his wounds made him gasp. They carried him through a corridor he had memorized by sound, then out into Mississippi sunlight that hurt his eyes. The ambulance doors shut with a metallic finality that felt like a lock. Movement began. The cost arrived immediately. Nausea, pain, and the sudden understanding that he would never see the familiar ceiling cracks again. At the station, the train waited like a machine that did not care what it carried. Cass stood beside an open door with a small kit. He took Brennan's thick folder, checked it, and placed it in a compartment near the railcar door as if stowing ammunition. Klaus was strapped in among other stretchers, other men breathing shallowly, coughing, staring. The result was that Klaus entered a corridor of motion where no one could step away. The cost was immediate. The first jolt tore sleep from him and replaced it with pain. Back in the railcar's first night, the fever tried again. Cass watched the thermometer, pressed fingers around the bandage edge, and counted breath with a stethoscope that seemed too delicate for the noise around them. Klaus forced his breathing slow and kept his eyes open, because closing them invited the ditch, the blast, the old certainty that he was dying. Staying present prevented him from thrashing and tearing stitches. The cost was that presence hurt, and hurting was only the beginning of what the journey would demand. By the second day, the landscape outside the window stopped being information. Fences, trees, fields, water, towns, everything passed too quickly to offer meaning. Inside the railcar, time became a schedule Cass imposed. Temperature checks, wound inspection, sips of water, thin broth, the tightening and loosening of straps to keep circulation from failing. The routine produced a fragile stability. The cost was that stability depended on supplies that could not expand and on a medic who could not become a surgeon. Heat and motion turned small problems into larger ones. Klaus sweated until his shirt clung to him, then shivered when night air cooled the metal walls. The railcar smelled worse as hours accumulated, and the smell seeped into him until he could not tell whether it came from the men around him or from his own bandages. A man down the row coughed until he retched. Another whispered prayers in a language Klaus could not identify. Klaus tried to treat the noise as weather. The attempt produced endurance. The cost was numbness that felt like losing parts of himself. Cass adjusted Klaus's position every few hours, not for comfort but to prevent the small injuries that became big ones in immobile bodies. Each shift pulled at stitches, and each pull made Klaus's breath catch. The adjustments produced circulation and reduced pressure sores. The cost was pain repeated by design. Klaus began to understand that in this corridor of motion, even care had to hurt. At a stop late on the second day, the railcar door opened briefly. Hot air rushed in, bringing dust and the smell of engine oil. Voices outside shouted instructions. Cass checked his kit, checked the other stretchers, and checked Klaus again as if the pause itself created opportunity for something to go wrong. The result was a new awareness. Their protection was not a wall but a sequence of small actions performed without error. The cost was dread that had no outlet because Klaus could not get up and walk away from it. That night his mind broke its agreement with the present. He woke, convinced he was back in the ditch, the air thick with smoke and dirt, his mouth full of grit. His hands clawed at the straps as if they were wire. His heart raced fast enough to make his wounds throb. Cass arrived in the narrow space beside him without theatrics and placed a firm palm on Klaus's chest. Weight, contact, a physical argument. "Train," Cass said. "Not there." The pressure and the words slowed Klaus's breathing enough to stop him from ripping at the restraints. The cost was that the panic did not vanish. It simply retreated, waiting for another opening. The next morning the fever climbed sharper. Cass checked the wound edge and found dampness that smelled sweet and wrong. He swore under his breath, then set to work with the discipline of a man who knew his limitations and had no option to ignore them. He boiled water on a small burner, cooled it, cleaned the area as thoroughly as the moving railcar allowed, and rewrapped the dressing tighter than before. He offered a rationed antibiotic dose and told Klaus, "All I've got." The immediate result was containment. The wound stopped seeping through the cloth. The cost was uncertainty, because containment was not cure. For hours after, Klaus listened to the railcar's rhythm and waited to see whether his body would betray him again. Waiting became its own kind of pain. He stared at the ceiling seams and measured time by the whistle, and by Cass's footsteps moving between stretchers. The watchfulness kept him from slipping into delirium. The cost was exhaustion, because watchfulness required constant attention to sensations he wanted to escape. Klaus felt the old impulse to minimize symptoms, to hide them so he would not attract attention. In war, attention attracted death. In captivity, attention attracted control. He forced himself to do the opposite. When pain spiked, he signaled. When thirst became dizziness, he drank. When fear surged, he pointed at his chest and then at Cass, asking for weight and steadiness rather than silence. The result was that Cass could respond early and keep damage small. The cost was surrendering the illusion that Klaus could manage alone. Days blurred into monotony measured by sound. The whistle's long cry marked distance. The wheel's cadence marked time. Cass's kit opening and closing marked survival. Klaus stared out the small window when he had the strength, letting unfamiliar land pass as proof that movement continued, whether he understood it or not. The view prevented him from turning entirely inward. The cost was that the changing landscape also confirmed how far he was being taken from any place that still felt like his own. As the train moved west, the air changed. Nights cooled differently. The dust felt drier. At one stop, Klaus saw men in different uniforms and heard vowels stretched in a cadence he had not heard at Camp McCain. The brief glimpse produced confirmation. They were approaching a region where even language would shift under him. The cost was that his anxiety moved from bodily survival to the unknown system waiting at the end. When Cass finally said, "We're close," Klaus's stomach tightened, as if anticipating another incision. Close meant a handover. Close meant Cass's steady presence would be replaced by new people who did not know him except on paper. Klaus tried to imagine a hospital that could rebuild him and a process that would not erase him. The attempt produced a thin hope. The cost was knowing that hope could be torn as easily as bandage cloth. The train slowed. The rhythm of the wheels changed. The railcar door opened and light flooded in so hard Klaus had to squint. The air outside was hot but dry, full of dust, and the sun looked harsher than Mississippi's. Orderlies appeared, straps were unfastened, and hands lifted him onto a new stretcher with practiced speed. The motion sent pain through his abdomen, and Klaus gasped in spite of himself. The result was arrival. The cost was that arrival began with pain, not relief, and the pain reminded him that every transfer was a risk. They rolled him through a station he could not name, into a vehicle, then into a corridor of polished floors and disinfectant that smelled designed rather than improvised. Brightness made every stain visible. The cleanliness felt impersonal, as if the building were a machine for sorting suffering. Klaus realized he had entered a place that could help him, by turning him into a case. The understanding produced cautious cooperation. The cost was the quiet grief of being handled as process. The receiving hall ran on paper. A nurse called numbers. A clerk checked boxes. A man in a white coat held out a hand and took Brennan's thick folder from Cass. The folder opened, pages flipped, stamps flashed, and Klaus watched the record of his body become someone else's property. When the nurse asked for his name, Klaus said it, Klaus Hoffmann, then heard the number assigned to him repeated with greater certainty. 217. The result was formal admission. The cost was a feeling of being reduced to what could be filed. A young clerk asked Klaus to repeat his history while reading from the folder, as if confirming that the patient matched the paperwork. Klaus answered in fragments and gestures, and each fragment dragged memory forward. He said explosion and saw mud. He said surgery and felt the pull of stitches. He said night and felt his throat tighten. The result was a completed intake. The cost was a small reopening of wounds that were not on his skin. Dr. Hudson met him in an exam room and worked quickly, as if speed were a moral virtue. Hudson unwrapped dressings, pressed near stitches, checked for warmth and swelling, and asked questions Klaus answered with broken English and nods. Blood was drawn. X-rays clicked. Klaus held his breath on command and felt the ache of doing even that. The result was a fresh assessment of a body that had changed since Camp McCain. The cost was exhaustion so deep, it felt like drowning in procedure. Hudson studied the films and spoke in a tone that assumed agreement. The plan would change. More attention to the wound edge that had threatened infection, a different schedule, structured rehabilitation starting sooner. Klaus felt panic rise. Change meant uncertainty, and uncertainty had killed men. He thought of Brennan's careful routine and Cass's limited kit, and he understood that resisting would not restore the past. It would only slow the present and increase scrutiny. Klaus exhaled and nodded. Cooperation kept him moving forward. The cost was that he had to give up the illusion that he could choose when change happened. Physical therapy began with humiliation measured in inches. Miss Miller read his chart and set him on the edge of a table. Pain flared along his abdomen and sweat broke out immediately. Miller told him to lift his foot an inch. Klaus tried. His leg trembled, rose barely, then dropped as if it had weight beyond reason. Miller marked the attempt and told him to repeat it. The result was a task he could attempt again tomorrow. The cost was that each repetition demanded pain as payment, and payment came without negotiation. Klaus resisted once, early, when the pain made him certain the stitches would split. He tried to lie back down, to retreat into stillness and avoid the risk of tearing himself open. Miller did not threaten him. She stated the arithmetic. If he did not move, he would lose function. If he lost it, he might not get it back. In the hallway afterward, Klaus passed a young man in a wheelchair whose legs ended above the knees. The man's face was calm in a way that frightened Klaus more than anger would have. The result was renewed effort. The cost was fear. Fear that his future might be a room he could not leave. The psychiatric sessions did not make the nightmares stop. They changed the terms of the fight. In a quiet room, Klaus listened to other men speak about collapsing roofs, burning streets, and screams that stayed in their ears. He recognized the relief of being understood, then felt the cost when their words dragged his own memories to the surface. He learned to set boundaries, to speak enough to be seen as participating, to stop before he drowned. The result was partial control. The cost was isolation inside the boundary because boundaries kept pain contained by keeping people out. There were small breakthroughs that did not feel heroic. One morning, Klaus stood without gripping the rail for a count of 5. Miller wrote the number down and told him to do it again the next day. The achievement produced a brief surge of pride. The cost arrived that night when pain kept him awake and his mind filled the sleepless hours with questions he could not answer. How long he would be here, whether home still existed, whether his body would ever stop bracing for impact. Months passed. The wound edge that had threatened infection hardened into scar. Klaus could walk with a limp down the corridor without gripping the rail every step. The camp marked him stable, and stability changed his place in the system. He became less urgent, more manageable, and therefore less attended. The result was transfer out of the acute ward and into a rehabilitation barracks where men did light work. The cost was that stable meant waiting, and waiting could last longer than pain. Waiting arrived disguised as routine. Klaus sorted papers in an office where a fan clicked overhead. He carried folders, learned English words for ordinary objects, and learned that ordinary objects could be weapons against emptiness because they gave the hands something to do. When the sun allowed it, he worked in a small garden plot and trimmed bushes into tidy shapes because tidy shapes were proof that effort produced visible results. The work produced small victories and reduced the sense of helplessness. The cost was that victories did not answer the question that mattered, where he would go when the camp no longer needed him. A liaison officer named Baker handled correspondence. Baker's hands smelled of ink and stamps. He provided forms and spoke politely as if politeness could substitute for certainty. Klaus filled in his mother's name, his last address, and the city he had left behind. Baker stamped the request and said it would take time. The result was a packet sent into a bureaucracy large enough to swallow it. The cost was that the packet created hope, and hope sharpened the pain of silence. Weeks passed, then more weeks. Other men received letters and became briefly animated by news of a home that still existed. Klaus received nothing. Baker offered plausible reasons: records lost, addresses changed, families displaced, and each reason sounded true. The result was that Klaus had no proof he still belonged anywhere beyond this camp. The cost was that he began to feel the camp's number fit him better than his name did, because the number at least had a place to live. He adapted anyway, because adaptation was how he had survived the war and then survived the train. He read books, practiced English, endured therapy sessions, and kept his body moving so the scars would not turn into chains. The result was a functional life inside captivity. The cost was distance. The more functional he became, the more he had to pretend the emptiness beyond the fences did not matter, and pretense exhausted him in a new way. One afternoon, the Texas sun pressed down so hard the ground looked bleached. Klaus stood in the garden with shears and trimmed a bush that had grown uneven. He paused and looked at his shadow on the soil. It was short, pinned tight beneath him by the high sun, as if there were nowhere for it to hide. The sight produced a moment of clarity. He had been moved from the edge of death to the edge of an ordinary day. The cost was the second clarity that followed. The timetable for his next movement was still blank. That evening he checked the mail slot out of habit and found it empty. He returned to his bunk and opened an English book, letting his eyes pass over words that promised future usefulness. Outside, the barracks settled into quiet. Coughing, distant talk, footsteps. Klaus understood that the war no longer tried to kill him in seconds. It tried to erase him in years, in forms stamped stable, in lines marked awaiting final disposition. He had survived the longest hallway. Now he had to survive the waiting without letting it turn him into nothing.